Thank you, Simon, and thank you for giving me the opportunity to open this symposium. And yes, I'm sorry I couldn't be there in person, but as Simon said, my wife is pregnant, was due a week ago, so it could happen anytime. So if I rush out, you know why that will be. But for now, I think everything is calm, and I think I can finish this with no stress. So thank you for organizing this event, both today's symposium and the Datathon that will follow. I think this is really a great idea, bringing together experts both from Danish universities and from around the world. And as you said, Simon, in an alternate timeline, I would probably have been there actively participating in this event instead of just giving these opening remarks. I think the different talks and panel debates you have on the program today all look very fascinating. And the focus on time series data that you will work on during the weekend is something I would have loved to delve into myself. Now I just have to wait for whatever great ideas you come up with. As Simon just mentioned, I did actually have an active career in research before I decided to waste my PhD in bioinformatics and got elected to Parliament back in 2019. Before that, I worked in research for a number of years, both at universities in Denmark and abroad and in industry. Now, alas, I do not have time for that kind of work anymore. But that's not completely accurate, actually. It is hard to say anything positive about the corona pandemic. But the fact that it actually hit us shortly after I made the jump from bioinformatics research to politics meant that my education wasn't a complete waste of time. Early on in the epidemic, I started doing my own crude analysis of data modeling as part of my political work, solely for my own amusement. I followed the daily numbers of COVID-19 patients admitted to Danish hospitals, and I made my own predictions for the days to come. This was at the time when everyone in Denmark, including my colleagues in Parliament, finally learned what exponential growth actually means. Eventually, I started using my predictions when I explained the situation in my group, the Social Liberal Party, or Radikale Venstre, and I used it when I had to decide what the correct mode of action was, in my opinion. I even had a daily exchange with Henrik Dahl from the Liberal Alliance Party, where we shared our predictions of the newly admitted numbers of people in hospitals for the day after. And we were, unfortunately, pretty accurate. What I did, though, was nothing compared to what actual researchers delivered. If you are active on Twitter, and in politics, you have to be active on Twitter, it is clear that citizen science has flourished during this pandemic. I follow a number of people, a number of researchers that make daily predictions of infections or regularly publish their own analysis of COVID-19 data, often accompanied by thorough written documentation. And this is something I actively use in my work, in my political work. Of course, I follow how the pandemic is progressing around the world, but my primary focus is on Denmark. And here I recognize the strength in having a multitude of qualified people analyzing the same data, debating how to best perform the modeling, and discussing how to interpret the results. I could mention a number of people by name that make valuable contributions. But to avoid missing someone, I won't go there. Instead, I'll just give you some general examples. It could be the daily analysis of, say, infections or hospitalized people compared to the rolling weekly average. This gives me a good idea of how the epidemic is progressing, or the trajectory of what we are looking into. Or it could be the epidemiologist who regularly focus on especially vaccinations and hospitalizations and give his own opinion on whether we should worry or not. This is something I read, I use, and I debate in my group, and we have our meetings with the minister. And all this is made from crunching through the same publicly available data. This is how we learn, how we improve, how we become better. This is well known in science, of course, where we want to share and we want to have multiple people working on the same problem. And because I know this, I from the very beginning of the epidemic, argued that we have to make not only the data, but also the code used for modeling and making predictions, we have to make that publicly and easily available. And this is not because I doubt the qualifications of the people who are working on this, far from it, but because I truly think that it would qualify the debate and improve the basis of our decisions. The situation we've been through over the past year and a half has been extraordinary. we have made political decisions that have far-reaching consequences for everyone in Denmark. The discussions and the political negotiations we have had have to a large extent been based on data, on models, on predictions. And because of this, it is even more important, I think, to have an open approach and make sure that all information is available to other experts. In that light, it is not surprising that I am really looking forward to learn what results will come from this symposium in the following Datathon. I have great expectations, and I'm just sorry I couldn't be there myself, but I assume that Simon and the other organizers will make sure to let me know what you come up with during the weekend. And with these words, I'll just say thank you and have a great nerdy weekend.
So thank you, Stinus. If there are one or two questions, you can have that from the audience. So raise your hand if you have one and let us know. We have a mic ready for you guys. I actually have one, Stinus. I wonder at which point was the political environment most stressed, or when was the most critical situation that you saw on behind the scenes that perhaps the rest of us didn't see?
Well, I think everybody saw that. It was definitely early on when it became clear that not only couldn't we keep the coronavirus out of Denmark, which of course was never really a possibility, but also that we were actually on a trajectory where we had to do something to make sure that we didn't overwhelm the healthcare system in Denmark. So that's back in February, March in Denmark, as we all know. That's when it became really clear. I mean, we had the first initial discussions about this virus back in, I believe it was just before Christmas, so in December, and where we had a few meetings about what was happening in China. But we didn't really discuss, well, we did discuss Denmark, of course, but it wasn't really the primary focus back then. But during the first months of 2020, that's when it became really clear, and we had to act really fast. And in retrospect, maybe too fast, but that's the most stressful period by far.
Thank you, Stinus. There's one question from Sarah. Yeah, wait for it, otherwise I can't hear you.
Thank you. Can you hear me?
Yes, I can.
Great. Thank you for the address. I was just curious, you've named a few data sources that you really relied on, and they were mostly in this category of how the healthcare system is doing. Were there other variables that really factored into decision-making in the Danish government?
Yeah, so early on, it was primarily the number of infections and especially the number of hospitalizations we focused on, because that's what we had. But during the pandemic, the epidemic in Denmark, of course, the focus shifted a bit, and we also looked on behavioral data. I know Michael is there. I assume he is. I can't see him. But the whole HOPE project and all that data, that became really crucial in how to handle the epidemic. And I use that a lot. And I still read the reports coming out from Michael's group. I use that, and I assume my colleagues do as well, because that's, of course, important. One thing is how to, you can say, how to handle an epidemic theoretically, but if we don't have the public with us, then it doesn't really matter. So having an understanding of what works and how it's taken down and how people interpret that, that's really, really crucial, especially in the later stages, I would say.
Thank you. That's really interesting.
Yeah, do you have a short question, Leo? Yeah. We do have, this is the final question, yeah.
Make it good.
Looking back, what do you think you could have done better when it comes to data analysis during the pandemic?
What I could, or what the scientific community could?
The government could have done better.
So, as I said, I think most members of parliament and government didn't really do any data analysis themselves, with a few exceptions. But what we got, of course, was primarily from SSI, and I assume they're also present in the room. So what could have been done better? The one thing I myself also criticized a bit early on was not the analysis, but making as I also mentioned, making data and making the code publicly available. I think that's really important. And as I said, it's not because I doubt the people working on that. I know a lot of these people. I mean, it's not that big a community in Denmark, so of course I know these people. But it's because I think, honestly, that making the code available will make sure that other people can go through it and see whether they agree, whether there's something we should have changed, how the different parameters are set. All that matters a lot. And we had a lot of discussions about that back then, and that was been just before the summer 2020. And that's the one thing I would point out would be it should have been faster in making these things publicly available.
Well, thank you, Stinus, and thank you for the question. Leo is our collaborator from MIT, if you don't know Stinus. But Stinus, thank you so much for being with us, and we'll definitely keep you updated on the results of today's symposium and the rest of the weekend. Yeah,
Thank you.
Give a hand to Stinus.